أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. وصلي وسلم على أشرف خلق الله محمد بن عبد الله وعلى آله وصحبه وسلم. السلام عليكم ورحمة الله. Lecture 13. After this one, inshallah, there will be others lecture. Inshallah, next week, inshallah, we are finished course. Our talk today, inshallah, be about the imaging of the spine and spinal cord. Spinal and spinal cord. Vertebral column and spinal cord anatomy. Three vertebrae divided into cervical, thoracic, lumbar, and sacral coccyx area. There are 37 cervical vertebrae and 12 in the thoracic region and 5 in the lumbar region and also 5 in the sacral, which are fused, and also 4 in the coccygeal area. Also, these are fused vertebrae. And look to the curvature of the spine as the cervical lumbar. There is a normal lordosis, which is in the, can be seen in the cervical lumbar, which is seen as the curve forward, cervical and lumbar vertebra. There is a curvature which is curved forward. Curve forward. This is the normal lordosis at cervical and lumbar. These are curved forward, and in the thoracic and the and in the thoracic, there is a kyphosis in the sacrum and thoracic area. Here you can see the sacrum and thoracic. There is a curvature backward. But this is called what? Called kyphosis. So there are two areas of lordosis in the cervical and in the lumbar, which are curved forward or anteriorly, and in contrast, in the area of the thoracic and sacral area, the spine curved backward and convex backward, and this is called kyphosis. If it reverses, this indicates abnormality, and if it is straight, also is abnormal, considered abnormal. So the normal spine or vertebra should be like this. Sometimes this spine seen as straight. This is called loss of normal lordosis. Loss of normal lordosis. If this can be seen in patient with pain. يعني مثلا patient عنده muscular spasm, the spine appears straight. يسمى loss of normal lordosis. Loss of normal lordosis. So this is indicate which what is the appearance of the spine, and this is seen on the lateral view. Seen in the lateral view. In also, there is a normal. The spine should be straight. Should be straight in the midline. If there is a curve towards the lateral or the right or left, this is called scoliosis. So the spine should be straight. The number should be aligned and straight. And if there is a curvature laterally towards the right or towards the left, it is called scoliosis. So scoliosis is abnormal lateral curvature towards the left or right, and there are many causes for this. May be congenital, may be due to pain, may be due to fracture, مثلا, tumors. Many conditions can cause, this lateral curvature of the spine. If the imaging modalities that or image studies and methods that can be used for assessment of the spine and spinal cord include plain X-ray. Plain X-ray done mainly for assessment of the bone. The bone is for the vertebral, uh, for the vertebra, not for the spinal cord. And myelogram is a radiological examination that done by injection of contrast media in the CSF. So this technique required in administration of contrast into the CSF space, then followed by imaging of the area of the spine. Can be done by X-ray or CT or even MRI. فعندنا CT myelogram and X-ray myelogram أو بيسموه conventional myelogram or MR myelogram. Also, computed tomography CT can be used for assessment of the spinal cord. MRI, discogram. Discogram means injection of contrast as the area of the disc space, then followed by imaging of this area. Spinal angiography. Angiography means evaluation of the blood vessels. So for the spinal angiography, we evaluate the arteries and veins that supplying the spine and spinal cord. Ultrasound can be used for evaluation of these structures, and radiolightning bone scan. That technique required IV injection of radioactive material or radiopharmaceutical or radioisotope, and then this agent we deposit in the bone, and then we scan the patient with gamma camera to identify the abnormality of the that can be demonstrated by this technique. DEXA scan, dual energy X-ray absorptiometry, as we explained this in the MSK lecture. This is done for assessment of osteoporosis. With this DEXA is the gold standard imaging technique for assessment of osteoporosis. And osteoporosis can be seen or can be assessed in the spine by X-ray, but DEXA is the gold standard imaging technique for assessment of osteoporosis. Now we are going to talk briefly about any of these modalities. We start with X-ray, here the plain radiograph, which usually will be the first diagnostic imaging test, as it is available cheap and quick, and so it is usually it is the initial imaging examination done for assessment of the spine. This X-ray can help us in many conditions, such as spinal alignment. The spine should be well aligned, not backward or forward move, or يعني الspinal vertebrae should be well aligned. يعني ما تكون شنو well aligned like this. The spine should be well aligned. This and you can draw a line through this area, and this vertebrae are well aligned. And there is no slipping of any vertebra backward or forward. This X-ray, plain X-ray, can help us in evaluation of the alignment of the vertebral body, and also if there is abnormal curvature, such as scoliosis or abnormal lordosis or abnormal kyphosis, and spinal instability, especially spinal instability done by dynamic scan, such as X-ray with flexion and extension view. يعني نعمل during flexion or extension to assess the spinal instability. This is optional view for assessment of the instability, done with flexion of the spine, مثلا cervical spine with flexion to assess the instability. Also, plain X-ray can assess the congenital defect of the spinal column, the spina bifida occulta, or spina bifida aberta. Also, plain X-ray can assess fracture in case of trauma, although CT is better, but X-ray can be used for assessment of the fracture of the spine. And moderate osteoporosis, as the DEXA is the best and gold standard, but moderate osteoporosis can be assessed by plain X-ray for the spine infection in the disc or the vertebral body or any part of the spinal can be assessed by the plain X-ray. There is a specific radiological features for the infection. Tumor in the bone or the spinal also can be assessed by plain X-ray. And we are going to talk about the spine, different regions. But this is X-ray frontal for the cervical region. You can see this is the cervical region. You can see this is the spinous process. All these are spinous process. This is the body of the spine, and these are the transverse process. These are transverse process. But this is AB or frontal view of the cervical spine. AB view. lateral طبعا هتكون ايش من الجانب زي دي. This is the lateral X-ray for the for the cervical region. This is cervical X-ray lateral view. Also you can see from the C1, C2, 3, 4 till T1. This is the body of the cervical spine. Between the body, this is called intervertebral disc space. This is the fiat disc. لاحظوا ان الديسك not seen in the plain X-ray. This is the area of the disc spaces, and these are the spinous processes. This is the spinous processes, posteriorly oriented spinous processes, and these are the pedicles. And this is the superior, and this is the inferior articulating facet. Between them, there is a facet joint between the inferior and superior articulating facet. لاحظوا أهم شيء تلاحظوا شنو؟ الalignment should be well aligned, the intervertebral disc spaces and the body height. يعني الارتفاع بتاع البودي should be يعني of normal height. يعني there is no reduction or increase of the vertebral body height. This is the cervical spine شنو lateral. عندنا other اللي هو شنو ممكن نعمل شنو oblique. In oblique view لاحظ the oblique دايما help us in assessment of the pedicles. If you are interested in the pedicle, we can do this oblique view, which is additional view. And also you can see the other part that has been explained, spinous process, and body of the spinal of the vertebral body can be seen, and the pedicles. This is the additional view, not standard. Standard is AB and lateral view for any part of the spine. Next to the cervical is also, this is an additional or optional view for assessment of the dense orthodontoid process of C2. So this is the C2, and this is the lateral body of C1, and this is the dense orthodontoid process. Look for this orthodontoid process, which is projecting between the lateral mass of the C1, the space between the orthodontoid process and the medial edge of the body of the C1 should be equally. Yani this distance should be equal to this distance. Look to this distance from here to here should be equidistant. If one less than other, this indicates abnormality. Also the lateral mass of the C1 and the C2 should be aligned, well aligned. يعني إذا رسمنا خط من هنا should be the lateral part should be well aligned. So this is a normal نفس الفيو ده بسموه open mouth orthodontoid. يعني done with patient opening his mouth to identify or to assess the orthodontoid process. لأنه this is the commonly can be traction. This is orthodontoid process. Or sometimes the C1 also can be used for assessment of C1 fraction. As inshallah we are explaining this in the next slide. Also this is the orthodontoid process with open mouth. Again, This is a dense orthodontoid process. Lateral mass of C1. Look to these spaces or distance. Should be equidistant from the dense to the medial edge of the of the lateral mass, and the alignment of the C1 and C2 lateral part of C1 and C2 should be well aligned. So this is a open mouth orthodontoid process. This is optional, يعني done when we are interested on the we are going to assess the fracture of the dens or fracture of the C1. Next part is the thoracic vertebrae. There are 12 thoracic vertebrae. This is AB. Thoracic vertebra connected to the ribs. This is the ribs, and these are the pedicles. These are pedicles. Here, somewhat pedicles, and these are the spinous process. This is our spinous processes. These are the body. Between the body, this is intervertebral disc spaces. Intervertebral disc spaces. This is thoracic vertebrae AB, and this is lateral. Also lateral. The vertebral body should be well aligned. يعني إذا رسمنا خط لازم يكون مر بكل الإيدجز كده. دي alignment. And the body height. لما نقول height معناها الارتفاع في كل البادي. يعني there is no compressed vertebra أو increased size. يعني كلها of normal size. Not collapse and not enlarge the vertebral body. So this is a normal vertebral body height. Normal vertebral body height with normal intervertebral disc spaces and well, normal alignment. Normal alignment. Next part is the lumbar spine. There are 5 lumbar spines. This is AB. This is 5, 4, 3rd, 2nd, first vertebral body. These are the spinous processes. This is a spinous process, and this is the transverse processes. Transverse processes. Intervertebral disc spaces. Intervertebral. Look to the vertebral body height. Vertebral body height. Vertebral of normal height and normal size. And in the lateral, you can see well the the intervertebral disc spaces. These intervertebral disc spaces لاحظ هنا بتكون increase هي السبيسز دي increase from L يعني 1 L2 لكن at the level of L4 L5 normally this space is narrowed. يعني لاحظ ان اذا قلنا اذا مثلا جبنا اكس راي لاترال فيو لقيت دي كده this is considered normal. يعني normally the L5 this is L5 number vertebra number 5 and this is the sacral number 1. The disc spaces between L5 and S1 is normally narrow compared to the others. Please take care of this. L5S1 is normally narrow compared to the other. This is a lateral and this is a AB lumbar vertebral plane X-ray. The next part is the sacrum and coccyx. زي ما قلنا هم شنو used. This is AB for the sacrum and coccyx. of use like ما بتكون separate كده. This is lateral. This is L5S1. This is the L5 and this is the S1. This is the L5S1 disc spaces, and this is the sacrum, and this is the coccyx. The coccyx area. So this is the lateral, and this is AB X-ray for the sacrum and coccyx. This is imaging technique is CT. CT زي ما تكلمنا ودائما بنأكد انها هي cross sectional image. يعني هي بتكون axial but can be reformatted into sagittal and coronal. And this CT gives us more information about the bone and soft tissue. When we compare between the CT and plain X-ray, CT is better in assessment of degenerative disease changes. يعني degenerative or aging process can be well demonstrated by CT compared to the X-ray, plain X-ray. Herniated disc can be demonstrated by CT more or better than the the plain X-ray. حتى لو لاحظت مثلا كل دي إذا عندنا هنا disk space herniated أو bulging any disk cannot be demonstrated by، لأنه هو شنو؟ زي ما عارفين الديسك بيتكون من ايش؟ two parts، اللي هي السنترال بارت النيوكليوس بالبوزس، والبريفرال بارت بتكون الانيولس فايبروزس. النيوكليوس بالبوزس فيها شنو؟ جيلاتينيوس فلويد، فبتكون عشان كده تظهر كجراي كده، والانيولس فايبروزس فايبر، فلذلك هي ما بتظهر لان الديسك itself cannot be seen، يعني حتى لو كان normal or abnormal cannot be seen in plain X-ray. But in CT can be demonstrated. But still MRI is the best for assessment of herniated disc, as we inshallah we will explain. Spinal alignment برضه X-ray can demonstrate the alignment, but CT is better to assess the alignment of this vertebral body. Fracture is يعني هي fracture X-ray can demonstrate the fracture of the spine، لكن ال CT is better. ليش؟ لأنه ال X spine all of you know that spine هو complex ذاته شنو؟ anatomical complex structure، يعني فيه many parts، spinous process، transverse process، lamina، pedicles، وهو complex، فلذلك X-ray usually miss many fracture in the spine, but CT can be demonstrate this fracture when in cross-sectional or in reformatted sagittal or coronal or even 3Ds. Congenital and childhood anomalies, although it can be demonstrated by X-ray, but CT is better, اللي هي زي الspina bifida occulta or aperta. And also if there is a narrowing of spinal canal, the CT is better than the X-ray in assessment of this area. But this CT is good in visualizing inner details of spinal cord. The spinal cord there that cannot be well assessed by the by the CT. لكن حنجي نشوف MRI is the best. فthis is CT axial. Demonstrates the vertebral body, the spinous process, the transverse process, the spinal cord. زي ما قلنا ما بتكون not clearly demonstrated by the CT, and this is the body of the vertebral body. يعني نلاحظ ان the spinal cord not well demonstrated by CT. Spinous process, transverse. This is the lamina. This is the right and left lamina. And this is the pedicles. This is a fracture in the vertebral body. The CT can demonstrate this fracture. إذا عملنا X-ray for this patient, this fracture cannot be seen. So CT is better in assessment of the spinal fracture compared to the X-ray. تكلمنا كان المايلوجرام قلنا done by injection of contrast into the in subarachnoid spaces by needle inserted in the pack, and then we can scan the patient with CT or plain X-ray. عندنا CT myelogram like this or conventional myelogram اللي هي done by fluoroscopy. This is a fluoroscopic examination اللي هي myelogram done by after injection of contrast in the spine. This is a conventional myelogram nowadays not commonly performed because MRI can لأنه هي دي invasive imaging technique, بس MRI can be performed without this intervention. And also in patient with pacemaker, طبعا إنه في incompatible pacemaker. In this patient you can do this CT myelogram. This is CT myelogram. لاحظوا إن this is the vertebral body, the sagittal. لاحظوا إن this is the spinal cord. There is a narrowing of spinal canal at this level. اللي هي دي 1 2 3 4 5. Between 5 and 6 at this level there is a narrowing of spinal canal. necessity this CT مايلوجرام. فسو this is CT مايلوجرام. ليش سميناه CT مايلوجرام؟ لاحظ انه في contrast ده you know the subarachnoid space. This is due to شنو degenerative changes or osteophytes اللي هي دي المناخير دي الزوايد دي degenerative changes causing this spinal canal narrowing. MRI is a gold standard imaging technique for spinal disorder, as it can demonstrate the bony abnormalities, disc, muscle, soft tissue, ligament, and spinal cord. So, MRI is the gold standard imaging technique for assessment of the spinal cord. زي ما عارفين إنه ممكن نعملها ب MRI without contrast, and it can be done with contrast to assess the this what is this? What is this image? Yes, any volunteer? Yes. Is it X-ray? Is it CT? Is it MRI? What is this?
MRI.
MRI for which part? For which vertebral body spine part? Type cervical. Which plane? Is it coronal, sagittal, or axial?
Sagittal.
Sagittal. Which sequence? Which sequence is this one? ايش السيكونس دي؟ What are the sequences do you know؟ ايش يعني sequencing؟ MRI sequences. MRI sequences زي ما قلنا هي T1 T2 flare diffusion weighted image. في many sequences here. For which one is this?
T1.
Why T1?
CSF is white.
CSF is white. So when CSF is white, this is T2. يعني قلنا الفلويد دايما بتكون white or hyper intense or high signal in T2. So this is cervical spine, MRI, sagittal T1. What about this? Yes, this.
Okay.
Yes. Pardon. Yes, please try to comment.
The same.
The same for cervical also?
No.
This is a thoracic vertebra. طيب, also this is a lumbar. For the lumbar, you can look, please look to what is this? What are these? What is this like?
Vertebra.
Vertebral body. This is a body. Yes, the vertebral
This
body.
is
What
the
is this?
disc. The disc, doctor.
This is the disc. The disc, please look to the disc at normal appearance. The disc is this T2 should be white, hyper intense. ليش؟ لأنه هو containing gelatinous fluid اللي هو nucleus pulposus. Nucleus pulposus containing gelatinous fluid material, so it appear hyper intense, normally hyper intense. If it becomes hyper intense or flat, this is indicate abnormality. A normal this disc should be normally hyper intense and should be not slipping forward or backward between the intervertebral body, intervertebral disc. This is normal, not forward or backward, slip this intervertebral disc. Look to the appearance and position of this intervertebral disc as to identify the disc herniation or disc bulging. Also, this is the same here, alpha L1, 2, 3. Look to the body and intervertebral disc is hyperintense in this T2, and this is axial spinous process lamina. لاحظ انه اللامينا تو لاميني دايما بيحصل join together to form spinal process. دي مهمه برضه تعرفوها عشان في condition اللي هي لاحظ انه this is the left lamina and this is the right lamina. The two laminae join to form this spinous process. And this is the disc. The disc should be convex like this and not compressing this, the nerve or this, not bulging. This is the disc. The normal, red and yellow line. This indicates the normal position of the disc. It is not herniated. If it herniated, it will compress or indenting the exit nerve foramina. The nerve root. This is the nerve root exiting from the spinal cord. Look to the normal disc position, and also this is the spinous process lamina, right and left. This is a spinal cervical spine coronal MRI T1, and this is cervical sagittal MRI T1, and this is the lumbar T1. Now we're going to talk about some pathologies and to identify the radiological or imaging features of these abnormalities. Very soon we'll start with congenital anomalies of the spine. And then the spinal dysrhythmia, which can be divided into a group or into clinical radiological entities. The first one is spina bifida aperta or open spinal dysrhythmia. Spina bifida aperta. This is occurs when the cord and its covering will be outside. There is no skin covering the abnormal opening. كيف يعني؟ This is a normal vertebral body. This is the spinous process. وقلنا عندنا two lamina join to form this spinous process, and this is a spinal cord in the center, and this is a arachnoid space, and this is a CSF. This is a normal, spinal cord, and this is a normal posterior arch and of the, of the spine. Lakin sometimes there will be absence of the spinous process due to failure of joining of the two lamina. Two lamina fail to join each other to form this spinous process. المنطقة دي تكون open. طلعت إنه there is no spinous process because there is a failure of joining of two laminae to form this, this spinous process. فدي بتكون open. There is a hole here. If the content اللي هي spinal cord والmeninges is covered by the skin, دي بسموها spina bifida occulta. Spina bifida occulta. But in case of protrusion of the content of the اللي هي ممكن تكون meninges or the spinal cord could be protrude through this opening. If the meninges protrude through this opening, بنسميها meningeocele. So meningeocele is characterized by protrusion of the meninges through this opening. And if the spinal cord protrude with the meninges بنسميها شنو؟ myelomeningeocele. Myelo for the spinal cord and meningeo for the meninges. So this is myelomeningeocele. If there is an opening but the content is still in place, covering by the skin. This is called spina bifida aberta, occulta. But this called spina bifida, aberta. So in spina bifida aberta or open spinal disc occurs when the cord and its covering communicate with outside, or يعني there is no skin or tissue over the sac. كده كلنا مايلومينينجوسيل or sometimes مايلوسيل only، يعني احيانا بيحصل protrusion of the spinal cord only. But when the vertebral body defect without any herniation or bulging of the content, this is called the spina bifida occulta. So the spinal cord and meninges are within its normal position and covering with the skin, with the normal skin like this. But this is difference between spina bifida aberta and spina bifida occulta. But MRI is the best modality to assess the spinal canal and the extent of abnormality of spinal cord in congenital anomaly. But CT can show the bony abnormality. لكن for the meninges and for the spinal cord يعني اللي هي as it is the soft tissue, MRI is the best. This is plain X-ray. You can see this is spinous process, normal spinous process. But at this level, L5, there is no spinous process. This is the lamina are not joined to form this spinous process. But this is spina bifida at L5S1 spina bifida. لكن ما عارفين حتكون occulta or aberta according to the bulging or herniation of the content. لكن the content and on the X-ray difficult to be seen يعني the meninges and the spinal cord. And also this is there is the absence of the spinous process. So this is spina bifida. There is no spina. There is no spinous process, and also at this level there is no spinous process. So this is also multiple spina bifida, or spinal dystrophies. But this is congenital. زي ما قلنا MRI is better, but this is MRI sagittal T2. You can see this sac اللي هي protrusion of the meninges which containing CSF. This is MRI T2 sagittal. CSF appear hyper intense, and this is the axial. You can see this is herniated sac fill of CSF, but this is a meningeal because this is a CSF within the meninges. And this is the appearance of this meningeal, the defects through which the meninges can be herniated, or sometimes the spinal cord in case of myelocele. But this is meningeal. طيب انا اتكلم عن fracture. يعني هناخد example of one fracture of the spine اللي هو جيفرسون fracture, other name يسموه بيرس fracture of C1. زي ما اتكلمنا عن الأودونتويد process with open mouth for odontoid process. اتكلمنا عن normal this space or this distance should be equally. اللي هي distance between the dens and the medial edge of the C1. لكن تلاحظوا هنا there is a discrepancy. This space is not equal to the other side, and also there is the C1 and C2 are not aligned. The C1 is laterally moved. It is not aligned with the C2. So the C1 extends beyond the margin of the lateral mass of C2, and also there is an asymmetric widening of the gap between the odontoid process or the dens and the medial edge of the C1. The space there, the gap there not equal to the other gap. This indicates there is abnormality or fracture in the C1, and this can be confirmed in this CT coronal reconstruction. لاحظ overhang. يعني this is the lateral mass laterally not aligned with the C2. Is moved or slip laterally. This is slip laterally. And also the gap between the dense or odontoid process in each side is not equal. فبعدها عملنا axial which demonstrates the fracture in the arch of the C1. This is a fracture and this is a fracture and this is a fracture. So this is called Jefferson fracture. Jefferson fracture is a fracture of the can be seen in the C1. ممكن يكون in the one on the one side or two or three, and the signs of the odontoid process open mouth. يعني ما بنعمل اكس راي العاديه ما بتعمل لنا assessment of this condition. لابد نعمل شنو odontoid process with open mouth. نشوف الساين دي mal alignment between C1 and C2 and the asymmetry of the gap between the dense odontoid process and the medial edge of the C1 lateral mass. And CT is the best. Although this open mouth can add many information, but CT is the best imaging technique for assessment of this fracture. This is how the fracture, posterior arch fractures. هنا عندنا two side fracture, هنا this fourth fracture can be seen in this C2, but this is a Jefferson fracture. So Jefferson fracture is the fracture of C1 طيب نتكلم عن collapse of vertebral body. ايش كلمة collapse؟ Collapse vertebral body when there is a decrease of the height of the vertebral body. يعني when there is a loss of height of the vertebral body بيسموها collapse vertebral body. طيب if there is a collapse in the vertebral body يعني عندنا body كانت small compared to the other, to know what is the cause, نحن you have to look to the disc between the disc spaces or disc and the pedicles and posterior vertebral wall. When we assess this part, we are going to discover what is the cause of this vertebral body called vertebral bodies. طيب what are the differential diagnosis of vertebral collapse؟ إذا كان عندنا vertebral body الهايت بتاعها decrease, this may be due to metastasis, myeloma, fracture, infection, osteoporosis. دي الكوزز. metastasis, myeloma, الفراكشر او التروما, infection, الميتاستاسيس. نشوف how to differentiate, how to reach diagnosis by the imaging. طيب حيكون عندنا اكس راي مثلا عندنا فيها اكس one of the vertebral body is small or collapse. You have to look to these three parts, disc, pedicles, and posterior vertebral wall to discover the cause. In the metastasis and myeloma, there is a bone destruction and يعني يكون عندنا شنو lytic lesion or lytic tumors. lytic tumors اتفقنا كان الليتيك هي شنو؟ الليتيك تيومر كنا قلنا عندنا يا فوكال يا جنرالايز. lytic tumor بتكون شنو بلاك اريا. فيكون عندنا شنو اندوميتاسيس مايلوما يحصل لنا bone destruction or lytic tumor. This destruction mainly seen in the pedicles. Mainly seen in the pedicles. So the destruction of the pedicles is the evidence of of the metastasis. لذلك نحن إذا البيشنت suspected metastasis دائما إذا عملنا اكس راي you have to look to the pedicle. يعني البيديكل دي أكثر منطقة الميتاستاسيس بتحبها. تلقى البيديكل destructive حصل لها destruction. So the pedicles are the good place for the evidence of bone destruction on the plain film. So إذا دارين نعرف إنها هي metastasis or not نعرف إنه شنو بيكون عندنا إيش destruction of the vertebral body يعني with lytic lesion, and this is lytic lesion mainly seen in the pedicles in case of metastasis. طيب نشوف الانفكشن هنتكلم وبعدك نوضح الساين دي على الايمج براكتيكال يعني. طيب الايمج الانفكشن the disc spaces is affected by infection. So the infection affecting the adjacent disc spaces. and this disk space may be شنو narrowed or obliterated. لكن the pedicles بتكون شنو intact normal يعني. اذا اهم شيء تتذكر انه في الانفكشن دائما الديسك سبيسز will be شنو narrowed or obliterated and the pedicles are normal. طيب how about the osteoporosis؟ طبعا كل الكوزز دي بتعمل لنا شنو small vertebrae، يعني احنا بنلقى الفيرتبرال small or collapse. طيب الاوستيوبوروزيس characterized by generalized reduction of bone density، زي ما شفتوها كثيرا. الاوستيوبوروزيس means انه reduction of generalized reduction of bone شنو density، تلقى البون density reduce. اما الديسك spaces may be normal or increase. الاذرز البيديكلز بتكون شنو normal. اذا البيديكلز دي لاحظتوا انها هي بس destructive by شنو metastasis، لكن الانفكشن بتكون normal والاوستيوبوروزيس normal. The disk spaces in the metastasis normal, but in the infection it will be narrowed or obliterated. And in osteoporosis, the disk spaces may be normal or increase in the diameter. طيب in case of trauma بتلقى السمول body. What are the other side؟ بتلقى البادي عندها شيب كاركترستيك شيب بيسموه الويدج شيب، لكن البيديكلز والديسك بتكون نورمال. الويدج شيب vertebra is characteristic feature of trauma according to this. طيب اول شيء لابد انه نحن نتكلم عن collapse vertebral. look to this X-ray. You can look and see this vertebral body is small compared to the other. نحن قلنا you have to look to this شنو pedicles and intervertebral disc space. pedicles and intervertebral disc space. طيب this is vertebral body is small or collapse. And how about the disc spaces and pedicles? Any volunteer? طيب لاحظوا اول شيء هي سمول وفيها شنو؟ فيها ليتيك ليجن. الفرتبرال بودي دي هي فيها ليتيك ليجن، المناطق السوداء دي. and شنو؟ the disc spaces is normal، يعني disc spaces is normal. This is highly suggestive of metastasis. So metastasis although it can mainly affect the pedicle، لكن هسه البيديكل الحين في الصورة دي ما واضحة، يعني كان عملنا اوبليك كان ممكن تكون مبينة. Although you can see there is a lytic lesion. يعني it is not totally normal، لكن يعني if we do oblique view this pedicle will be more clear than this. أهم شيء إنه عندنا small vertebral body with multiple lytic lesion. النقاط السوداء دي lytic lesion with normal intervertebral disc spaces. This is a طبعا البيشنت كلينيكالي ممكن يكون عنده برايمري نعرف إنه this is شنو vertebral collapse vertebra due to metastasis. In this one, the this vertebral body is small, and you can look and see the intervertebral disc spaces is affected. The disc spaces is narrow. This area. لاحظ إنه compare this with this disc spaces is narrow. زي ما احنا قلنا الديسك spaces إذا كانت narrow in addition to small vertebral body, this is a goes with infection. So this is osteomyelitis أو الانفكشن in general. حتى البوتس disease يحبوا الديسك، يعني كان affecting the disc. This is a small vertebral body, this one, and you can see this is a collapse with concave وبتكون ويد شيب اللي هي لاحظوا انه شنو concave الابر شنو or superior surface. فthis is a due to شنو traumatic collapse of vertebral body. In this one you can see this vertebral body is small compared to the other one. This is the small vertebral body. هو شيء نحن لازم تلقاه small وتيجي تشوف other sign. ف if you look to the general density of the spine, لاحظ انه the density of the spine is reduced. So there is a generalized decreased bone density with concavity of superior and inferior, this disk spaces. So this is شنو osteoporosis. In osteoporosis بيكون شنو there is a generalized generalized decreased bone density with a small vertebra. So to differentiate between the causes of vertebral body collapse, you have to look to the density of the bone, to look to the pedicles, to look to the intervertebral disc spaces, and to the shape of the collapsed vertebra. طيب اتكلمنا عن السمول فيرتبرا او الان نتكلم عن الدنس فيرتبرا. ممكن احيانا الفيرتبرا تكون انكريز اوف there is increase of density تسمى sclerotic sclerosis which is demonstrated on plain film or CT. لما نقول sclerosis طبعا معناته هي عملنا plain film or CT، يعني the vertebra appear very dense very sclerotic. But this is what is the differential diagnosis of the dense vertebral body. عندنا many causes also may be metastasis or lymphoma or Paget disease or hemangioma. All this may cause increased vertebral body density يعني تكون sclerotic vertebral body. طيب to differentiate also metastasis can cause dense vertebra, and this is a primary cause of the secondary vertebral body tumor may be from the prostate or the breast. This is the most common. لو تتذكر في المحاضرة اللي فاتت كنا آخر سلايد اتكلمنا عن metastasis of the prostate to the vertebral body، فكانت the vertebral body is very dense or sclerotic, more sclerotic metastasis. Metastasis is the cause of the dense vertebral body. Also, malignant lymphoma can cause very dense vertebra, Paget disease, and this is a Paget disease, sometimes or usually difficult to be differentiated from the tumor. لكن عندنا feature which characteristic of Paget disease اللي هي Paget disease called causing increase of size of the vertebral body. فدي help us in differentiation of Paget disease from the primary tumor of the vertebral body. يعني هما الاثنين بيكونوا dense، لكن in the Paget disease there is a increase or expansion of overall size of the vertebra. And also in the Paget disease طبعا كان اتكلمنا عنه برضه انه هو causing abnormal trabeculation and coarsening also of the trabecular pattern in addition to the increased vertebral body density and size. hemangioma برضه اتكلمنا عنها تقريبا في in the MSK، لكن حنجي نوضحها برضه. فالمهم بس الان احنا بنتكلم عن الدنس فيرتبرا. يعني ايه دنس فيرتبرا؟ يعني سكلوريتك فيرتبرا، يعني لما تكون more opaque than the other one. This is dense vertebra. هنجد هل is it due to metastasis or hemangioma or Paget disease. this is a very dense vertebra due to metastasis. حتى بيسموها ivory vertebra، يعني تكون very dense sclerotic vertebra. this is a commonly causing by the prostate and breast primary. And also this vertebra and this appear more dense than the other. يعني لاحظوا دي more dense or sclerotic, this and this. And if to look to the size of the vertebra, it appear more expanded or more enlarged than the normal one. لاحظوا دي هي AB diameter. This also is more enlarged, and there is a abnormal trabeculation. This is a abnormal trabeculation pattern. This is a Paget disease. Paget disease causing in addition to increased vertebral density, also cause enlarged vertebral or expanding vertebral body with abnormal trabeculation, dense and thick trabeculation pattern اللي هي الخطوط دي. لكن this is a normal trabeculation. hemangioma طبعا كان اتكلمنا عنها انها بيكون characterized by vertical striation، يعني تكون في الخطوط دي more prominent in hemangioma. لكن من البدايه لاحظ ان هي more dense إذا ال 3 سلايد دي كلها فيها ال vertebral body more dense. This is more dense than the other and this more dense and this more dense يعني sclerotic يعني أكثر بياضا من ال others. هي characterized by vertical striation with normal size vertebrae. vertebral body دي هي كلها normal size لكن دي شنو؟ abnormal trabeculation pattern with expanded vertebral body. أما دي with very dense vertebral body with normal size فدي is a metastasis. طيب الآن تكلمنا عن الفرتبرال بودي collapse and density. يعني نتكلم عن الديسك spaces. The disc space very important to diagnose disc space يعني طبعا دي يعني هي very common presentation. يعني البيشن بيجوا ب back pain ونعمل لهم اكس راي او بعد ذاك نجي نعمل ام ار اي. you have to know how to assess the disc space. فديسك space narrowing means a reduction in intervertebral disc height. Intervertebral disc height, this is a normal, but this is decrease, reduction in intervertebral disc height. And the common cause of this intervertebral disc space narrowing due to degenerative changes اللي هي زي الاوستوفايد دي والسكلوروتيك في الاند بليد دي سكلوروتيك اند بليد and osteophyte الزوايد دي. This is the most common cause of the disc space narrowing. this is plain X-ray demonstrates the disc space narrowing. الكوز بتاعي ايش؟ degenerative changes اللي هي evidence by what؟ by the osteophyte. this is osteophyte and end plate sclerosis. المنطقة دي لاحظوا بيضاء مرة. end plates sclerosis. this is لاحظوا لكن في in the plain X-ray الديسك itself not demonstrated. لأن to be a this if you are want to assess the disc itself you have to request MRI. لذلك هذا البيشن ممكن ضروري نعمل له MRI to assess the disc. طيب عندنا terms هي familiar for you نمشي عليها سريع. السبونديلوزيس والسبونديلولايسيس والسبونديلوسيس. what is spondylosis؟ لما نقول spondylosis معناته انه there is a degenerative changes مثلا زي يكون عندنا ستوفايتس وامبليت سكلوروزيس بنسميها سبونديلوزيس degenerative changes of the spine. اما السبونديلولايسيس is the defects in pars interarticularis. فاذا عندنا defect in the pars interarticularis بنسميها spondylolysis. اما السبونديلولايسيس is forward or backward slipping of one vertebra over the other. مثلا زي دي لاحظ انه دي well aligned لكن دي not aligned مع the other. فسو the L4 is move anteriorly. دي اتحركت للامام دائما بتتحرك لفوق. يعني this L4 is displaced anteriorly. This is anterior spondylosis or of L4 over L5. They are not well aligned. This is X-ray lumbar lateral view demonstrate the anterior displacement of L4 over L5. This is L4. دي آخر واحدة L5. طبعا this is the sacrum. And also this is the MRI demonstrate how this L4 is forward move over the L5. لاحظ انه دي ماشي aligned لكن دي بعد تحتها حصل movement. فدي L4 is slipped forward over the L5. فاذا السبونديلولايسيس may be forward or backward. يسموه anteriolisthesis or retrolisthesis and sometimes could be associated with spondylosis. And the common site for this spondylolisthesis is L4, L5 or L5S1. This is the most common site for spondylolisthesis. طيب الديجنريتيف تشينجز مرت بينا كم مره تكلمنا عنها. الديجنريتيف ديسك فممكن كان بي diagnosed by plain X-ray اللي هي should be done as an initial investigation for assessment of the degenerative changes. And also you can do additional view اللي هو dynamic view اللي هو flexion and extension view for assessment of the spinal instability زي ما قلنا أو spondylolisthesis. طيب what are the signs of degenerative disc disease؟ لما نقول degenerative disc disease اللي هي spondylolisthesis دي spondylosis أقصد، فدي بنعمل AP and lateral view. بنلقى الديسك سبيس نيروينج زي ما اتفقنا، بالاضافه لان شنو في الاوستوفايت والاند بليد سكلوروزيس. end blade sclerosis. These are the signs of degenerative disc disease اللي هي زي دي مثلا. This is disc space narrowing and osteophyte and end blade sclerosis. المنطقه دي اكثر بياضا، وحتى هنا في اكثر بياضا، فذيس از شنو نسميها ديسك ديسك degenerative disc disease. طيب عندنا تيرمز مهمه للام ار اي، ترمينولوجي دي لما نسمي نقول ديسك بريتروجن. لما اذا مشيت قريت اي ريبورت بتاع ام ار اي لمبر او مثلا اي سباين عملوا ام ار اي بتلقى التيرمز دي بيستخدموها كثير. ديسك بريتروجن، ديسك هيرنيشن، ديسك سيكوستريشن. فوات از ذا ديسك بريتروجن؟ ديسك بريتروجن معناته انه بريتروجن ذا vertebral disc and nucleus pulposus through the annulus fibrosis. حصل شنو protrusion، just protrusion. but in disc herniation بيحصل له او يسموها disc extrusion or disc prolapse. بيحصل شنو extrusion of the nucleus pulposus، يعني كانها شنو بتكون طلعت من من annulus fibrosis through the tear in the annulus fibrosis. ما بلجي فقط، حصل كانه حصل extrusion، يعني في بارت من النيوكليوس بالبوسس دي حصل له herniation او extrusion. اما لما نسميها ديسك سيكوستريشن دي معناتها حصل ذا في separation of the fragment. يعني لاحظ انه حصل ديسك herniation اول في بارت حصل لها extrusion from the normal nucleus pulposus. اذا حصل لها separation بنسميها ديسك سيكوستريشن. نوضح الكلام ده تقريبا في الايمج اللي حتكون جايه. طيب to assess the degenerative disc disease نحن زي ما قلنا هنعمل ام ار اي، هنعمل اكس راي، بنلقى الساينس اللي هي الديسك سبيس ناروينج والاند بليد سكلوروزيس والاوستيوفايت. طيب ام ار اي spine without contrast can be done. It is a preferred initial imaging modality for suspected myelopathy or radiculopathy. الراديكولوباثي دي ايش؟ اللي هي pain due to affection of the spinal nerves اللي هي spinal root. لكن اذا كان البين due to يعني compression of the spinal cord دي بنسميها myelopathy. اذا the indication for نحن نعمل MRI اذا البيشن عنده myelopathy or radiculopathy. اذا لاحظ انه اذا البيشن جانا بباك بين you have to do plain x-ray. لأن بسط لكم الحكاية دي، إذا البيشن جه بباك بين نعمل plain x-ray to assess the spine، نشوف هل في degenerative disc space changes، disc space narrowing، osteophyte and end blade sclerosis. دي بنقول إنه البيشن ده عنده disc degenerative changes. طيب متى نعمل MRI إذا البيشن كان عنده symptoms بتاعت myelopathy or radiculopathy؟ حتى لو كانت الاكس راي نورمال you have to perform this MRI. يعني ما بنعمل MRI الا يكون في indication. طيب what are the signs finding of the degenerative disc disease in MRI؟ اول بنلقى الديسك dehydrated. لو تتذكروا كان قلت لكم تتذكروا النورمال appearance of the disc in MRI T2 بتكون وايد، بيحصل لها dehydration معناتها بتبقى بلاك، بيسموها dehydrated disc ذات بير hypointension T2. ثاني لو لاحظتوا في الاكس راي الديسك اتسلف ما بنشوفها، بس بنشوف الديسك سبيس ناروينج، لكن on MRI you can see the disc itself protrude or herniate or prolapse. فإذا كان this MRI can demonstrate the disc herniation or prolapse, herniation of the disc or prolapse. And also you can see evidence of compression of spinal nerve اللي هي النيرف root اللي وضحنا لكم قبل في النورمال MRI النيرف root compression by the by the herniated disc can be also assessed by this MRI. الكلام ده evidence بقى إذا كان عندنا spinal nerve or spinal cord indenting or compression or compressed by the disc بيحصل لنا شنو فوق narrowing of spinal canal or compression of the cecal sac. واحيانا بنلقى شنو edema of spinal cord. spinal cord can be بيكون فوق edema بيكون عنده hyper intensity on T2. يلا نشوف الكلام ده practically. This is what is this image. It's plain X-ray. It's ultrasound. What is this? Yes.
MRI.
MRI. Which plane? Coronal. Axial. This is a lumbar spine. This is sagittal MRI. Is it T1 or T2?
T2.
This is T2. طيب please, do you see the abnormality? At which level يعني؟ And what is the abnormality or at which level the abnormality do you see? طيب احنا كان وضحنا لكم قلنا لكم look to the normal MRI for the lumbar spine T2. تتذكروا قلنا لكم the normal appearance of the what is this?
Disc.
Disc. Is this normal? This one.
No.
What abnormality do you see?
It's hypointense.
Yes, it is hypointense. It is hypointense. What is your name, please? How this appears? This disc space. Disc again. Is how this disc is how this disc appear again. Yes.
It must appear hypointense, but here it's hypointense.
Is hypointense. Yes, it is hypointense. So we called it dehydrated. Dehydrated. Please, after the lecture, send me your name, please, after the lecture. This is a hypointense. What is this? What is the level of this disc? Which one? How to know the level? Yani this is, or these are lumbar vertebrae. Which is this one? Number. Which number of this? Like what is this vertebral body number? This is number. This is the last one. So this is number.
5.
It's 5.
5 doctor.
Yes, this is 4. This is 5. What is this disc space between which vertebral body? before the 5 معناتها this is L4 L5 يسموها L4 L5 يعني the disk space between L4 L5 it is dehydrated. disk space between L4 L5 is dehydrated لأنه شنو loss of it is normal signal, and also the L5S1 also dehydrated and also you can see there is a disc herniation and extrusion. لاحظ انه في حتى في جزء من الديسك حصل له شنو upward superior شنو migrated لاحظوا إن دي بارت من الديسك. وان there is شنو narrowing of the cecal sac حتى المنطقة دي معناها narrowed يعني دي normal cecal sac لكن at this level. So the finding of this lumbar spine MRI T2 is dehydrated and narrowed disc space at the level of L4, L5 this one and L5 is S1 and there is a disc extrusion اللي هي دي انفصل دايما من انفصل خالص من النيوكليوس فالباز بيسموه ديسك extrusion with narrow شنو السيكال ساك اللي هو دي المنطقة دي شنو بقت narrow. طيب anyone to comment on this one? This is a patient present with cervical
MRI.
Yes, MRI. T.
There is abnormality in cervical spine.
Yes.
T2.
Yes, T2. What do you see?
Hypointense in the disc.
Yes, the disc. You can see this disc is ماله حصل له شنو؟
Herniation.
Herniated. This disc is herniated. What is this level? How to count the vertebral body? This level. This is first, second. Come on, this is first, second, third, fourth, fifth, sixth. So this is the بنسميها C5, 6 يعني between the C cervical vertebral number 5 and number 6. This is C5, 6 vertebral disc spaces. There is a herniation of disc at this level of C5, 6. عملت لنا شنو؟ لاحظوا انه السباينال كورد هنا فوق شنو برضه؟ to signal. This is spinal cord normal, لكن there is a signal hyper intensity due to the herniation of this cervical of this disc. فلذلك البيشنت ده جاي شنو؟ myelopathy symptom related to spinal cord compression. So this is a vertebral disc. This is a disc space degenerative disease. تكلمنا على البادي vertebral body والديسك. الان نتكلم عن الباديكلز. في كلام مكرر اللي هو اتكلمنا انه الباديكلز اكثر مكان بيحبها الميتاسيسز. So in plain film the pedicles are the best assessed in the frontal view. The frontal view is the best film to demonstrate the pedicle. This is the pedicle. But CT can demonstrate the pedicle more than the plain X-ray. If there is a destruction or sclerosis of the pedicle, this is should be highly suspected metastasis. لأنه زي ما قلنا الميتاستاسيس بتحب البيديكل، لذلك إذا لقينا البيديكل destructive زي مثلا زي النورمال بيديكل، لكن the right one is absent, is destructive. Also there is no pedicle and this is the pedicle normal pedicle. But when there is a destruction of the pedicle, this is raising the possibility of metastasis. يعني العكس إذا patient عنده metastasis you have to look and assess the pedicle, and if we find the pedicles destructive by the on the X-ray or the CT, you have to put the metastasis on the top of your differential diagnosis. Also, this is the destruction of the pedicles, due to metastasis on CT axial. الاوستومايلايتس تكلمنا عنه برضه تقريبا زي MSK، يعني برضه هيكون كلام تقريبا شكلي مقرر. وان بلين فيلم يكون عندنا narrowing and destruction of intervertebral disc بس هناك كان اتكلمنا عن البون ان جنرال، ما عن الفيرتيبرال بادي. فحيكون عندنا narrowing and destruction of intervertebral disc، لكن اتكلمنا عنه قبل قليل انه is perivertebral soft tissue and end-plate sclerosis. and this end-plate sclerosis لما نقول sclerosis معناتها المنطقه دي شنو؟ dense end-plate sclerosis during the healing phase. طيب on MRI يكون عندنا bone marrow edema on acute osteomyelitis and also this لما اتكلمنا الاوستومايلايتس affect الانفكشن in general affecting شنو the disc spaces، لذلك هي affect the disc and paraspinal شنو soft tissue. مذكرين كان قلنا one of the differential diagnosis of the small vertebral، قلنا الانفكشن زي الاوستومايلايتس كان affect شنو كان affect شنو the disc spaces. on MRI T1 the osteomyelitis appears dark on T1 and on bright on T2. If we do MRI with contrast هيحصل لنا شنو enhancement of this vertebral body with of osteomyelitis after contrast. But this is شنو X-ray lumbar vertebral lateral view. You can see where is the abnormality. Which vertebral body is abnormal? You see the abnormality? وين الabnormality?
Yes.
Yes. Where is it? Where is the abnormality? In which vertebra? Number. في اللمبر vertebra دائما إذا أحسن
في
تعرف
superior والinferior.
This is number. What is this vertebral number? Number. This is 5. So this is
4.
And this is 3 and this is 2. So the abnormality in which vertebral body or in the disc space? In which one?
2 and 3.
The abnormality.
2 and 3.
Yes, the abnormality is here. Look to the disc space. This is 5, 4, there, 2 between the snow. 2 and 3. This disc space here is obliterated, and there is sclerosis of the end blade. That's the disc space here normal, and here normal. Like here is abnormal. فthere is a discitis اللي هي osteomyelitis. osteomyelitis قلنا بتحب الديسك. فthere is الديسك space narrowing and there is a sclerosis of the end plate. المنطقة دي بقت more dense and also this more dense with destruction of the intervertebral disc spaces at the level of L2, L3, and this is diagnosed as discitis or osteomyelitis. And this is MRI. It's T2 sagittal. Do you see the abnormality? There is a collection here. There is a collection here, and there is abnormal signal here. There is collection, high signal collection in the posterior epidural space. This is diagnosed as abscess, epidural abscess, and there is a abnormal disc signal. This one appears, more hyperintense, and you can see also there is, hyperintensity in anterior to the disc. But this appearance is consistent with this. This is زي ما قلنا شنو epidural abscess, and this is osteomyelitis. قلنا osteomyelitis دائما بتحب شنو الديسك affecting the disc signal intensity. طيب نتكلم شوية عن
دكتور.
spinal. Yes. يس
دكتور، الصورة اللي على اليسار في السوبيريور والانفيريور في مناطق فيها برايت مرة، هل هذا عادي ولا من الصورة يكون؟
دي مش مثلا دي قصدك دي كده المنطقة دي يعني
أيوة
دي
أيوة.
technical causes yes يعني دي this is not abnormal this is technical cause يعني but it is a good observation لكن this is يعني بيسموها artifacts يعني اللي هي unwanted shadowing due to technique it's not due to pathology it's a good observation. Spinal cord tumor may be extradural or intradural or intramedullary. يعني we can classify the tumor when this is a normal appearance. طبعا بينا قبل كده انه عندك spinal cord وال cecal sac والspinous process transverse process والlamina. If the tumor is seen in the extradural area, extradural metastatic tumor or tumor in the extradural tumor causing شنو؟ compression of the cecal sac. لاحظوا cecal sac this one is blue is pushed and compressed and also the spinal cord is compressed and displaced to the other side. This is معناتها نعرف ان this is extradural tumor. So extradural tumor compressed and compress the cecal sac and the spinal cord to the other side. لاحظ ال CSF بيكون normal. This is CSF normal. In the intradural extramedullary لاحظ انه المظله هديه اللي هي يعني السباينال كورد. This tumor is intradural لكن شنو extramedullary. How it appears? What are the features? The tumor undisplays the cecal sac. cecal sac لاحظ انه undisplays لكن displacing the spinal cord. لاحظ السي اس اف حصل له شنو؟ accumulation up above to the level of the tumor. The CSF is more لكن هي CSF is normal. فسوى this intradural extramedullary. اسهل واحد اللي هو intramedullary. intramedullary اكيد intradural فبيعمل expansion of the spinal cord. spinal cord يجي expanded. spinal cord expanded. So to differentiate between intradural extradural intramedullary and intradural extramedullary and intramedullary, you have to look to the spinal cord and to the cecal sac and the CSF. The kind cecal sac and spinal cord compressed and to the other side and يعني قصدنا الابسيلاترال cecal sac and the CSF above the level of the tumor is normal. This indication is this extradural tumor or extradural lesion. In the intradural extramedullary, there is the cecal sac as the الابسيلاترال cecal sac not compressed. لاحظوا هو في نفس المنطقة بتاعته لكن the CSF above the level of obstruction is there is accumulation or increased volume of the CSF above the level of the tumor. And in the intramedullary tumor there is expansion of the spinal cord. Again, this is the intramedullary tumor. لاحظوا عامل expansion of the spinal cord and this is a extradural and extramedullary compressing the cecal sac and spinal cord, and this is a extradural intramedullary, and this is a extradural and extramedullary tumor compressing the cecal sac and the spinal cord. لاحظ هنا CSF بيجي كثير ده لما يكون intradural CSF بيكون حصل له accumulation or increase the volume. لكن هنا in extradural بيكون normal CSF. طيب الاكستراديورال اذا لما نقول اكستراديورال معناتها ممكن could be from the bone or intervertebral disc or the soft tissue. الايمجنج كرايتيريا بيعمل لنا زي ما قلنا displacement of the سيكا away from the mass زي ما وضحنا في كيستر تيومر دايما بتعمل لنا compression of the cecal sac away from the tumor زي دي. This is the extra dural tumor. هيمانجيوما اتكلمنا عنها الان قبل شويه، بس الان لو عصوا كان عندنا صوره الجبال كان فوق شنو النورمال الانكريز vertebral bud dense vertebra كان one of the treatment diagnosis of dense vertebral bud is hemangioma. Hemangioma is the most common benign spinal neoplasm, can be asymptomatic يعني usually discovered incidentally on plain film زي ما وضحنا. هي كان بتكون characterized by شنو sclerotic vertebra زي ما كانت one of the differential diagnoses with prominent and vertical trabeculation زي ما كان وضحنا. قلنا عندنا vertical trabeculation لكن with normal side. CT can be also demonstrate this the same features زي دي. CT can demonstrate the same feature on the X-ray. on MRI اهم شيء تعرف انه بس من هيمانجيوما دي بتكون شنو usually بتكون hyper intense in both T1 and T2 زي يعني كانها فات hyper intense in both T2 and T1 and with contrast usually it is enhanced with contrast. اذا عملنا T1 with contrast بيحصل لها enhancement with contrast. The spinal metastasis common in the vertebral metastasis especially in the pedicle, but it can be seen in the intramedullary or extramedullary of the spine. والكل اغلب البرايمري ممكن can be metastasized to the spinal especially from the breast, lung, prostate, lymphoma and kidneys. All these can be metastasized to the spine. فالspinal metastasis plain film is used to demonstrate the metastasis to the pedicles. زي ما قلنا دائما اكرر لكم السباينال البيديكلز دي هي ده المكان المحبب للسباين للميتاستاسيس. So it can cause erosion of the pedicles of the vertebral body. طيب احنا عندنا الميتاستاسيس زي ما شفتوا كان في الليكشر الاخير ده osteoblastic or osteosclerotic دي نفس المعنى. لما نقول osteoblastic or osteosclerotic changes this is means انه the vertebral body becomes very dense and it can be due to prostate or Hodgkin lymphoma or breast cancer. لكن prostate and breast are the most common cause of osteoblastic or osteosclerotic vertebral metastasis. اهم شيء تذكروا كلمه اوستيوبلاستيك اور اوستيوسكلوريتيك ديل هم نفس المعنى نفس التيم، يعني معناته انه الفرتبرا هي فيري دنس. فاذا البروستاتيك كانسر one of the cause of osteoblastic or sclerotic vertebra. طيب الام ار اي is very sensitive in detecting vertebral metastasis. The patient can suspect metastasis or you can do MRI and also scintigraphy. دائما احنا بنعمل السنتيجرافي ده لانه هو also more is very sensitive لكن بس مشكلته نان specific. خلصنا الاكسترا ديورال والانترا. نتكلم على الانترا ديورال اكسترا ميدلري. انترا ديورال اكسترا ميدلري يعني هي located outside the spinal cord لكن within the dural sheath. عندنا example of this is schwannomas which is the most common intradural extramedullary. How this spinal schwannomas appear? It can be seen frequently in the spinal and lumbar region. Usually بتكون rounded lesion and can show erosion of the pedicles كأنها metastasis لكن هي بتعمل لنا erosion and enlargement of the neural foramina. This by X-ray. On CT this schwannoma shows bone erosion زي اللي شفناه في الاكس راي and the appearance of this schwannoma is maybe hypo or slightly hyperdense. On MRI schwannoma is usually iso-intense in T1 and hyperintense in T2 and shows 100% enhanced with gadolinium T1 gadolinium contrast. نشوف الكلام ده. This is MRI T1 and this is MRI T2 sagittal. You can see this well defined hypo intense lesion, and this is also hyperlobulated hypointense in T2. But this is characteristic features of the spinal schwannoma. Hypointense زي ما قلنا in T1, usually hypointense in T1 and hyperintense in T2. Yeah, it could be iso or to hypointense in T1 and hyperintense in T2. طيب تقريبا دي آخر شيء intramedullary spinal tumor may be spinal ependymoma or spinal hemangioblastoma or syringomyelia. هنتكلم عن السيرينجوميليا عن multiple sclerosis. السيرينجوميليا is abnormal من اسمها. syringomyelia is fluid filled dilatation of central canal of spinal cord. يعني spinal cord بيحصل له dilatation and this area filled with CSF with fluid يعني. لذلك الليجن دي هتكون عندها الفيتشرز of of the CSF. إذا أنت عارف CSF normal appearance on CT or MRI هتعرف إنه how to diagnose syringomyelia. So syringomyelia characterized by focal or diffuse cord expansion due to presence of dilatation of the spinal cord and this area filled with contrast. طيب how to diagnose this? The features on CT. إذا أنت متذكر إنه how CT appear on how the CSF appear on CT, you can diagnose syringomyelia easily. But so it has the density of CSF. معروف إنه CT on as the CSF appear of low density. So syringomyelia appear of low density within the area of dilated spinal cord. And when we give the patient contrast, this lesion will not enhance with contrast. It cannot uptake the contrast, non-enhancing lesions, this syringomyelia. طيب on MRI لأن هي containing CSF, so it has the features or signal intensity of CSF. معروف إن CSF appear of low signal in T1 and high signal in T2. لذلك هي cystic area within the spinal cord. This syringomyelia is cystic area within the spinal cord of low signal in T1 لأنه فيها CSF and high signal on T2. زي ما هي in CT not enhancing with contrast, also on MRI not enhancing with contrast. فدي مثلا اللي هي لاحظوا إنه spinal cord this is T1 and this is T2. spinal cord ماله حصل له شنو؟ cystic lesion within the spinal cord. فدي of لأنه فيها CSF لذلك هي of low signal or of hypointense in T1 and on T2 بتكون لنا شنو of high signal. فدي شنو high signal in T2. فدي syringomyelia. نتكلم قليلا عن multiple sclerosis. معروف هو autoimmune disease, most common demyelinating disease, most common in adults especially women, and it's commonly associated with optic neuritis. معروف إنه here can affect the brain and the spinal cord, maybe the head is affected by spinal cord. The imaging modality of choice is MRI to the diagnosis multiple sclerosis. How this multiple sclerosis appear on MRI? On T2 there will be one or more elongated poorly marginated hyperintense intramedullary lesion. So إذا لقينا في الspinal cord إن عندنا lesion that are elongated and poorly marginated يعني outline بتاعته unclear and hyperintense, this is the features of multiple sclerosis. And this multiple sclerosis may be enhanced with contrast or not. If it enhanced with contrast زي ما قلنا هي this indicating this is active multiple sclerosis. فمثلا this is MRI T2, you can see this elongated. لاحظوا elongated يعني بالطول كده elongated poorly marginated الاوتلاين ما مبينه كويس hyperintense within the spinal cord. But this is multiple sclerosis MS. And also this is MRI T2. لاحظ انه there is poorly elongated. الليجن هي elongated, not rounded, not oval, elongated, poorly marginated, the outline not clear within the spinal cord. And this is hyperintense, and this is a multiple. I know this is يعني أنا بعتبرها the most difficult here lecture. This is imaging of the spine and spinal cord. لكن إن شاء الله during the tutorial I will fix the problems and will focus on the most important point to be more clear for you. Do you have any question or any query or do you have any comment?
Thank you, doctor.
يعطيك العافية.
يعطيك العافية دكتور.